Welcome back. You're listening to the Mario Mukwata Show on Salam Media. It is at 12:30 on this Wednesday. So we all know what it's like to be afraid of something, or a certain situation where there is a real threat. Fear is a sensible response, and your body releases adrenaline to prepare for fight or flight. What do we know about phobias? What do you know about phobias? We hear about them, we read about them, but what do you really know about a phobia? Joining me on the line right now is Cassandra Govender, who is a registered clinical psychologist, to talk more about phobias. Hi, Cassandra. Hi, Cassandra. Can you hear me?
Yes, I can hear you. Can you hear me?
Yes, I can hear you. Thank you for joining me today.
Thanks for having me.
All right, so let's start off by defining a phobia. What exactly is it?
Well, when we get to a phobia level, it's actually a type of an anxiety disorder, and that's when you have really intense, continuous, but disproportionate fear about it can be an activity, an object, an animal, a situation. So it can be about a number of different things, but you just have intense fear directed at that specific thing. So a common one that people have is heights. So they're afraid of heights really intensely. Claustrophobia as well. That's another common one. But even dogs, cats, being afraid of those, never wanting to go to those, that's also indicative of a bit of a phobia.
Mm-hmm. Right. So when it comes to heights, I read something that it's not the fear of heights that we have, but rather it's the fear of falling. Is there some truth to that?
Well, it could be. I think for people it's different. But I think the real thing is that when you look out and you're really high above something and you have a look out, I think you just start to feel scared or worried, I guess, about falling, about landing, whatever it might be. Mm-hmm. I think the situation can evoke different things in different people.
Mm-hmm. So are there any symptoms to phobias?
Well, I think I want to start by saying that there are three different types of phobias. So there can be a specific phobia, which means there's a specific object, activity, or situation you are afraid of intensely. And that could be heights, as we spoke about, cats, dogs. Now, I think it's important to remember that on a phobia level, you are very avoidant of it. So it causes you extreme distress to be around it. So if you have to be around a dog, it makes you very, very anxious, or you try and avoid the situation altogether. So each of us, I think we have things we don't really like and things that make us feel a bit uncomfortable. I'm taking this a step further. It's not just it makes you uncomfortable, it causes you lots of distress to be around the specific event, activity. Then you get to that specific phobia. Then you get social phobia or social anxiety rather. Now that's more around when you are afraid to be humiliated or judged in a social situation, having to give a speech, a lecture, something like that. Okay, there's a specific social one that we separate. And the last is something called agoraphobia, and that's when you don't like to leave your home. So you don't like to be in situations where you cannot control how you're going to exit, how you're going to cope with it. So these are people that don't like to go to malls or anywhere else but stay in their homes. So in all three of those categories, it's marked by a lot of anxiety regarding that particular trigger. The way you think, the way you feel, and the way you act. And that can often be accompanied by a lot of physical symptoms. Heart starts to race, starting to feel shortness of breath, sweaty palms, a little funny feeling in your tummy, those kind of things.
Mm-hmm. Well, now that you mentioned social anxiety, I think I might have a social phobia because every time I see my neighbors, I'm like, I don't want to go outside. I don't think I'm ready to have a conversation with anyone. I'm just going to stay right here. All right. So are phobias triggered by any childhood events, or can a person develop a phobia in the adulthood or any time?
So you can develop a phobia at any time, and it's not always linked necessarily to a traumatic experience or something that has happened in your childhood. It can, and a lot of phobias do start in childhood, but you can develop them at any point. And it also can be behavioral, how you link something that's happening outside of you with what's happening inside. So, for example, if there is a loud noise that happens when you see a bird, every time you see a bird, maybe for a while, you might get a bit of a fright, in anticipation. So that's a bit of a reductionistic way of how I explained it there. But I just wanted to point out that it's something that can be conditioned as well. An experience we've had that then sort of leads to the development of a phobia, not necessarily a trauma-based one.
All right. Now, can they be treated with hypnotherapy?
Well, I'm going to suggest you different treatment options. So 100% it can be treated. And I think this is what's so important for people to realize is phobias are something that can really be treated. So when it comes to specific phobias, cognitive behavioral therapy is the way to go. And it's actually a process of retraining your mind and re-exposing your mind to the stimuli and reacting differently. So CBT is very helpful, cognitive behavioral therapy. Then when you go to social anxiety, you need a bit of a combination approach. So sometimes having some medication along with the therapy can be the most effective approach, as well as, because that's a little bit of an entrenched more exposing behavior. If you're afraid of pigeons, you can avoid it as much as you need, and then you can work on that. But the social anxiety is a little bit more pervasive in your life, as you mentioned with your neighbors. You can only avoid them so much. And then with agoraphobia, which is the last one, again, I think you need a combination of medication as well as psychotherapy.
All right. Now, people don't often talk about their phobias because of being afraid of being judged and the stigma that's attached to phobias and, being laughed at as well. So how best can we address the phobia stigma?
Well, people don't talk about mental health in general because we're too afraid to say that something is not perfect with us and that we're actually human, because no one is perfect. But particularly with phobias, I think I've generally observed that people are quite dismissive of them. So you might say, oh, I'm afraid to dogs. And they'll be like, oh, man, you don't have to be afraid. He's fine. Or I'm afraid of heights. Oh, it's fine. You're safe here. You don't need to be afraid. So people's instant reaction is to be quite dismissive, I think, because they can't understand, or perhaps they don't really want to understand. So I think the most important thing is to sort of take a step back, and when someone is expressing to you that they're afraid of something, to watch that reaction. So instead of trying to be dismissive and being like, oh, you'll be fine, to sort of ask them a little bit more about it, to check how often do they get afraid and what happens when they get afraid. So I think it's about being curious. The thing that we struggle to do as humans is be curious about another person's experience. We often want to fix it or find a solution for it without just listening to it, and suggesting to people, if they really find that this is a challenge in their lives, that they can get help for it. So it's not, it's a valid thing that happens to anyone. It's not specific people this happens to. And you'll be surprised if you actually take a look at yourself to notice how many things you're actually quite afraid of without even really thinking about it. So it's something that affects us all, but we can all get help for.
Well, if someone is afraid of heights, don't take them for bungee jumping, because we don't know what will happen to them in that situation. And speaking of which, we are very dismissive when it comes to things like that, because we decide what therapy could work for them, like with the bungee jumping. If someone's afraid of heights, we'll say, no, okay, let's go bungee jumping, and then eventually you'll get over your fear. But a person doesn't really get over their fear that easily, right?
No. So fear is something we can learn to overcome and learn to live with, but there's baby steps. You don't start with having fear of heights and going bungee jumping. First, you start with imagining what it's like to stand on a high ledge. Then it's standing on a small ledge and working through that anxiety, then going a bit higher. So it's all about taking the necessary steps, because I think that band-aiding it, which is just going bungee jumping, doesn't necessarily remove the fear or help you live with it. It just gives you a momentary experience of like, oh, I did it, cool, I'm done, I'm not doing it again, So I think it's always about remembering that when we have challenges that we're trying to wrap our mind around, it's always best to take the baby steps and build a good foundation rather than trying to just band-aid it.
And I mean, what's the point of band-aiding it? Because the fear is not going to be overcome. It will still be there. And at the end of the day, you still have this fear that you have to deal with.
For sure. And I think about the swimming example as well, where people are like, just throw them in the deep end and then let them swim and they'll learn how to swim, right? And in some cases, for some people, that does work. Their adrenaline activates, they learn how to swim, and they're like, cool, this wasn't so bad as I thought. But for some people, it can leave a lot of scars and a lot of fear around it. So it's about just reading what the individual needs and how best it is to help them overcome this. And there's really nothing wrong with taking a bit of time to help people through their fears.
Mm-hmm. Now let's talk about phobias in children. How do we recognize a phobia in a child?
Well, often you'll find them having a particular kind of reaction. So they're very avoidant to particular situations, and they might also get quite distressed around that situation. Now, again, the important thing is to recognize that and help them carefully. So I've once seen a video where a child was really afraid of a bug, I think it was. Now, throwing that bug on them is really not going to be the helpful way to assist them. I think what you need to do is slowly bring them in contact with what they're afraid of, so that you can help them regulate their anxiety while exposed to this. So I think the key is that parents can often exacerbate, or friends or peers can often exacerbate a fear of a child when they push them towards the thing that's making them afraid, rather than gently helping them being in the same space as that.
Yeah, I remember my fear with insects and spiders. I was bitten by a spider, and I had no idea that it was a spider until it was like too late. Anyways, I developed a fear of insects and spiders, and I remember once being thrown. Someone was playing with me. Was They were teasing me about my fear, and then they actually picked up those bugs, a centipede. We call them shongololo. They picked that up and they threw it at me, and then I just lost it. I was hysterical the whole way, because I couldn't believe that this is actually happening, and I didn't know that my fear was that intense. But now I know, and I think I'm going to be taking the steps in the right direction to getting the help that I need.
For sure.
All right. Thank you so much for your time, Cassandra.
Thank you for having me.
All right, that was Cassandra Govender, a clinical psychologist, just giving us some information and insight on phobias, what they are, what are the symptoms to look out for, and the treatment that is involved. I know it sounds like it's something that is silly, right? People being afraid of things like clowns, people being afraid of animals, people being afraid of insects, heights, the most common phobias that we know, but it is a thing, guys. It is a thing. It is a reality, and there is help as well. It is available. The help is there, so you don't have to go through the phobia alone. And if you are afraid of something, don't be afraid to tell people that you are afraid, and they should respect your decisions. Anyways, if you have any comments, questions, queries, or suggestions, please leave them in the comments section below, or send them to us on WhatsApp. The number is 061 766 0355. We will be right back. Oh, yeah, Allah. I need the best.